The Appropriations Subcommittee on Labor, Health, and Human Services and Education-related agencies will come to order. Certainly, we're pleased to have the Secretary with us today. Secretary Burwell, thank you for taking your time to be here. You know, one of my concerns that we've already talked about is finding out what spending number we actually have to work with and how we can work within the proposal that we've got from the department, which is substantially higher than last year's level. I hope we can find common ground so that we can really prioritize the concerns that we share with you and get the information to understand where we need more information to figure out why we need to look at this a different way, when we need to look at this a different way. The bill that the Congress has passed on the SGR issue, I think, gives you some ongoing capacity to look at how doctors deliver care in different ways. Certainly the community health center element of that bill, the ability to fund the shortfall and where the health centers would have been and where they've been for the last 5 years was a significant part of that bill. You know, there are 23 million patients in 9,000 communities are now served by those community health centers. The $150 per encounter cost is obviously a whole lot less than many of the alternatives, particularly the emergency room as an alternative. And this committee and the Senate generally have been very supportive of the community health center concept, and we look forward to you continuing to work with us and us working with you to be sure we're fully taking advantage of that. Last year, the Congress overwhelmingly passed reauthorization of the Child Care and Development Block Grant to improve health and safety standards and overall quality of child care programs. This is another area where the Congress has spoken. We look forward to working with you to see what we can do to meet the goals in that. Finally, as we continue to work with limited resources we are likely to have, funding should be targeted at programs that have shown proven and effective results, or programs that we all become convinced have that effective result potential out there. I'm pleased that the department has requested a $1 billion increase for NIH, the focal point of our nation's medical research capacity. One of the things that happened when I was in the House was a doubling of that funding, but then once we got to the doubling goal, that seemed to be the place to stop. I know that Dr. Collins and you and me and others don't want that same experience to repeat itself, that we set a worthy goal but don't understand the importance of having that goal extend beyond achieving the first marker in the goal. So we'll be continuing to work with you and NIH on that as well. Pleased to be working on all these issues with Senator Murray. We're also lucky on this committee to have Senator Mikulski, the vice chairman of the committee, and Senator Cochran often attends, as does Senator Alexander, the chairman of the authorizing committee. So a lot of people here very interested in what you're doing and appreciative of the work you've done in the time you've already been there. So, Senator Murray. Thank you, Madam Secretary. We have votes scheduled at 11:45, so it'll be my intention to be done when those votes occur. We'll do 5-minute rounds, and we'll go with Senator Murray and I and the ranking member and the chairman of the full committee, and then we'll alternate by order of arrival after that. And I should have time for a second round. Of course, there'll be time a week to submit questions in writing if we don't get to those questions today. So to start, I'm going to ask a couple of questions to start about mental health, and hope to get other questions in later so that everybody has time to ask questions here. First of all, we were able to get passed last year the Excellence in Mental Health Act that Senator Stabenow and I co-sponsored in a way that allows states to be part of an 8-state pilot. Just want to thank you for working, your staff working with us on those guidelines. There was one late thing that still hadn't been decided that was decided yesterday about what the boards of groups that apply need to look like. You know, hopefully we'll have not only a number of states apply, but some sense that there are more states out there, and the country is ready to begin to treat these mental health issues like all other health issues. I think that's a very important place for us to go, and hopefully we can do what we can in this committee to help us get there. On the GAO report on mental health as it related to the department could have been better. I believe just in the last few days, the department is going to move forward and look at those GAO recommendations. Of the 13 programs, of the 30 mental health programs out there, 13 are under SAMHSA. 4 of those apparently there was no real plan to even evaluate those, and that was one of the criticisms in the GAO report. Just wondering, as you look at that report, as you look at SAMHSA, as you look at mental health generally as it relates to health care, one, your response to the GAO report, and 2, anything else you want to say about the direction you hope to go with these mental health issues?
So with regard to the direction, I think it's an important and critical time with the passage of the Affordable Care Act, the legislation that you passed, and other mental health parity. I believe that as a nation, we are poised to take the biggest step we've have taken in a very long time to put these issues, behavioral health, mental health issues, on parity and to make progress on them. And we look forward to doing that. With regard to our conversations with you and Senator Stabenow, and thank you both for your leadership, we're going to try and beat the statutory deadlines that have been put in to implement your bill, because it is one of the things I think everyone knows, 1 year, 9 months for me. And so the idea that we can get that done and done quickly and get these things in place so that we have those 8 up and running, and these states have 8 states up and running, but continuing to do the work that it takes to implement mental health parity. And that's about payment systems. That's about stigma. That's about how we implement our grant programs, which brings me to the GAO issue. In the GAO issue, there were I think there were 2 fundamental issues that we want to hear and take very seriously. One has to do with the issue of coordination and making sure that we're coordinating across the government. And I've asked SAMHSA and the Assistant Secretary for Planning and Evaluation to come together to help do that inter and intra government coordination. With regard to the question of our grant-making abilities and the question of that evaluation and the quality of our grant-making, I think you all probably know we have a new acting Deputy Secretary, Dr. Mary Wakefield, who is the highest-ranking nurse in the federal government, and she comes from HRSA. And so HRSA has made a lot of progress with regard to this question of grants and evaluation, and we're going to see if we can share some of the best practices from our department and see how we can continue to make progress on this issue of evaluation.
Thank you, and I think we want to look at what we can do to help enable you to do exactly that. If there are things that need to be said in report language or moved around or in the budget, let's talk about that and be sure we get on that track where this happens. I'm going to go ahead and go to Senator Murray. A lot of questions that I might ask will be asked by others, and we'll see what's left when we get back to me. Thank you. We've got a little more time on the vote than we thought we had, so there's time for a second round here, and 11:55 is the scheduled time for the vote, so hopefully we can work with that time. On the issue of dietary standards that Senator Moran brought up, he brought that same issue up at the FDA hearing, and Commissioner Hamburg stated that she really didn't have a direct role in this and she was an advisor. Today, you've stated that you hadn't really looked at the law yet. Seems like there's a certain running for the hills here. Secretary Vilsack said that sustainability falls outside the guidelines. So the one person we've talked to who's looked at the law appears to think that sustainability is not an issue. And you may want to argue it should be, and all you got to do is change the law for that to happen, not add it to the law. So we'll be watching that, I'm sure. On, I've got a question on this. I've got a couple of questions for the record. On risk corridor, the risk corridor program, Secretary, the Affordable Care Act, or at least last April, let me be sure I'm right here, the department released guidance stating that the risk corridor program would be implemented in a budget neutral manner. My impression from what the discussions I'm hearing now, that somehow the risk corridor program would find revenues somewhere else to make up the difference. So is that your view?
With regard to, I think, the guidance that was put out at that point in time, and I think that I was at that point in time going between, but with regard to risk corridors, a program that is about making sure we have premium control and put downward pressure on premiums, which I think is something we all think is important. With regard to the program, we believe it will be budget neutral. CBO has scored it as budget neutral. The question, I think your follow-up question will be, what if it is not? And at this point in time, what we have said is it is our expectation it will be budget neutral. CBO agrees with us that it should be budget neutral. Certainly in this year, what would happen if it weren't is it would fall over into the next year in terms of the payments that come in to pay that. But if in the end, and the end so that we're clear of when the end is, it's 2017. If there were any issues, I think the insurers believe that commitments have been made, and at that point, one would have to find appropriated funds.
And so 2017 is the end of the program.
Yes, these are the
theory being by then insurance companies should have figured out how to set up the structure in the marketplace and profile.
That's correct. And so with regard to the 3 R's, the risk corridors, reinsurance, and risk adjustment, 2 of those go away on that timetable. And one of them was based on what we used to Medicare Part D that actually didn't go away in that kind of a short time frame. But I think, yes, the idea is by that time, people understand the marketplace well enough to get this.
Well, money from discretionary dollars, if that's necessary, would be something we'd talk about next year, you would think.
The question of whether or not you need the appropriated, I think the question is do you need appropriated dollars? And I don't know that we're going to have any signals. We certainly won't have a signal even about this year until about the end of the summer. And then we'll know what the first year, because it's a 3-year program. And right now, all the data is starting to come in.
Designed in the scoring of the Affordable Care Act not to cost money. That it would all
budget neutral is where it has been at this point in time.
Right, we will see. On RAC audits, I think what I heard you say in response to Senator Langford's, one of the things you were looking at was the incentive structure to bring these cases.
Yes, what we're looking at in terms of the incentive structure to bring the cases and to bring any case that you wouldn't win. So if you bring a case that you're not going to win, you're not getting anything. And if you bring a case that you can't get done in a set period of time, you don't get anything either. So changing some of those incentive structures in terms of the things that we can do administratively is important. I think the other thing in terms of the increase that occurred in cases, we kind of didn't get into this because what he distinguished between the backlog issue. Part of the backlog occurs because there is no real cost for a provider to bring all their cases, to appeal so many, because there is only upside as a provider. And so making sure that we have any size and amount, the cutoff is very low. And I think we need to look at questions of what should the cutoff be for how little money you can appeal for because of the question of the processing. And then the second question is, what are the steps for you, and is there any bar in terms of you appealing everything? So there's the issue of the RACs, there's the issue of the providers, and there's the issue of our processing. And I think all 3 of those things we can put in place improvements to both reduce the backlog, which is essential, and have been working with the Congress and working with others about in a bipartisan way to make those improvements. The funding will be important. From the perspective of this committee, funding additional ability to review those cases, because I think those are judicial. It's a judicial process, and so we have to have a certain type of judge, an appeals judge that can review. And so we have a strategy that's about taking administrative actions, things that can get rid of some of the backlog, additional hires that we need to do to process the cases that are before us, and creating prevention in the pipeline so that people aren't as encouraged to do certain types of things, some of it related to RACs, to come into the system.
Are you allowing new cases to be brought while you've got this huge backlog out there?
The issue is how the cases get brought in terms of the racks. It's divided in terms of the way the legislation was passed and what it banned that racks could do. There's a limitation, a time limitation with regard to the racks. So some things are coming through, but portions are not.
Senator Murray.